Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
In endometriosis, on per vaginal examination, you will see presence of retroverted fixed uterus, and this retroverted fixed uterus cannot be corrected manually. There is limited mobility of the uterus, and in the adnexia, tenderness may be seen in the adnexia, or mass may be palpated, has chocolate cyst. Chocolate cyst is seen mainly in the ovaries. There can be tender nodules on the uterosacral ligament. Then the adnexial mass. The adnexial mass can be most commonly, it will be a chocolate cyst or endometrioma. The chocolate cyst or endometrioma contains brown color. This brown color of chocolate cyst is due to the hemosiderin pigment. Ultrasonography. Ultrasonography shows cysts with homogeneous internal echoes or ground glass appearance. Chocolate cyst does not respond to medical treatment and always needs surgical removal. Investigation.
thank you and thank you for watching.